come with me to try to attempt to remove the scar on my face.
So this is a lip lift scar, and you can see that she has a track mark type of appearance to her scar. And what that tells me is that this was high tension closure. Now, she might be susceptible to less than ideal healing in that area, but regardless of that, when we see these vertical striations that are that well imprinted, usually what that tells me is that the deep sutures are placed a bit too close to the surface of the skin. That will increase the track marks that you see after a lip lift. And that's what gets people sometimes nervous about a bullhorn style lip lift. Now, there are ways of reducing that tension, and that's why with my EllaLift lip lift procedure, we spent a lot of time trying to mitigate this type of high tension closure. Some of that has to do with a skin muscle separation flap. Some of it has to do with the type of sutures that are selected. And of course, the deep placement of the sutures, of that deep layer of sutures, is so critical to try to offload the tension away from the skin surface so that the area can heal well. So you cannot remove this scar. You can try to make it less obvious, and it looks like she's getting some microneedling done, and they're doing maybe some laser treatment at the same time and also numbing up the area. But my suggestion usually is for patients to give this time. Usually things do improve on their own, and I would wait for most of the pinkness to be gone before starting up all these scar treatments. And I generally advise against microneedling for lip lift scars because of the risk of atrophic scars, where instead of a raised scar, you can actually get a divoted scar. And so that is something that I don't usually recommend. Instead, laser resurfacing with either CO2 or erbium YAG is typically the better go-to method for improving the appearance of the scar, but I wouldn't do it too early. I usually recommend waiting about 9 to 12 months to do this type of treatment. And if the scar gets hypertrophic, then we can do some steroid injections earlier to flatten that scar. Once it's flat, then you can go through some various laser treatments. But in my practice, it's only about maybe 3 to 5% of patients who end up getting laser resurfacing. Most people heal extremely well with just the passing of time, the use of scar gel, because a lot of this depends on surgical technique. Again, study surgeon's gallery in advance. Make sure you're seeing lots and lots of different examples, different skin types, different ethnicities, genders. You have to get a sense of how you might look recovering from a lip lift surgery.